We're going to discuss the diseases within the genitourinary system. First, we've got to understand those systems. The urinary system, basically what happens is we get waste and toxins that build up in the blood that is filtered out through the kidneys, and that waste, along with water, will move out of the kidneys into the ureters and then collect in the bladder, where it will move out, evacuate the body through the urethra. That flushing action of the urine helps flush out microbes that could be traveling within the system. We also have desquamation of the epithelial cells lining the urinary tract. This means shedding of those cells, just like our skin cells shed. The cells anywhere in your body will shed, but that there's a particular amount of it that helps with protection of microbes sticking within the urinary tract. Most of the bacteria that are in your GI tract aren't able to adhere at the level that would allow them to colonize your urinary tract because of the flushing action. So that helps. The acidic pH of urine also stops growth, lysozyme that breaks down peptidoglycan, lactoferrin that hoards away iron from the bacteria, and then secretory IgA because this is part of the mucosa. In the male reproductive system, some of the aspects of some of the infections that we're going to be talking about with the male infections is to understand how their system is set up. So we have basically the urethra within the penis. That is the single entry point within the male reproductive system. And that the urethra leads to the bladder as well as to like the prostate, essentially. So that prostate gland that's down here, there's access there through this channel as well. And that there is ability to enter the urethra and affect any of these tissues in the male reproductive system because of that access point. Then we have that female reproductive system where we have the urethra leading into the bladder, where the urine will collect, but then separate from that, we have the vaginal orifice leading into the vagina with the cervix and the uterus. And then coming from the uterus, we have the fallopian tube, encasing basically the ovary where the eggs would be coming from. Just kind of looking at from the side. For the defenses of the female reproductive tract, this will vary over the lifetime of the woman, and it depends highly on the hormonal levels at any given time. The mucus that is secreted within the female reproductive tract is protective. It causes microbes to stick as well as to be easily kind of flushed away. Secretory IgA antibodies in the mucosa, the low pH of the vagina begins in adolescence. This is as the hormonal changes are happening. It favors the growth of lactobacillus bacteria, and those lactobacillus bacteria are acid-producing, fermenting bacteria, and that leads to the acidic pH of the vagina. Then the biota of women in childbearing years also seems to be something that is in place to prevent the fetus from getting infected. So that's a helpful thing for the developing fetus. For the difference between females and males. Now, females have a shorter urethra, so they're more likely to have urinary tract infections because it's less distance for bacteria to travel. However, men, if they have been circumcised, so having your foreskin, if you are uncircumcised, you usually harbor a different kind of bacterial biota in the folds of the foreskin. And so this can actually lead to increased inflammation just naturally from the natural biota in that area. And so men who are uncircumcised are actually more susceptible to these sexually transmitted infections that we're going to talk about today. So it's not necessarily has anything to do with cleanliness or hygiene, just due to the normal biota associated with having foreskin versus not having foreskin. Same kind of residence in the external portion of the penis as what we have in the external genitalia of women typically, and we often see Lactobacillus and Streptococcus species. Microbes that are associated with STIs can take up house basically in that genital tract and even not have signs or symptoms associated with them many times, whether you're male or female, it just depends on the microbe. Men who engage in vaginal, anal, or oral intercourse can harbor bacteria in their own genital tract that can then lead to vaginosis in females. And vaginosis is basically bacterial overgrowth of bacteria that aren't supposed to be there or in numbers that they're not supposed to be at. Again, female biota, we have lots of the lactobacillus leading to that low pH and the acidity there. And that our microbial biome shifts just with our normal hormone changes throughout just like, your given month or whatever. Cycling from menstruation to fertility and back again is going to cause a shift in your biome in that just due to the presence of certain hormones. But once you are postmenopausal, your biome is pretty much going to stay the same. As you're encountering those sexual partners, whether you're male or female, that's going to change your biota as well. Candida albicans is present in low levels in the healthy female reproductive tract. It's just whenever we eliminate the bacteria due to whatever circumstance that the yeast will then overgrow, causing a super infection. So different terms for our urinary tract infections, if we're just talking about the urinary tract, starting with urethritis. Urethritis is the infection and inflammation of the urethra. Cystitis, we have the inflammation of the bladder due to infection, leading to pain in the pubic area, frequent urge to urinate, and then pain during urination, even inability to evacuate completely. And we might have cloudy or smelly urine, even blood in the urine as a result of a bladder infection. And then we have pyelonephritis, which is the infection of the kidneys causing inflammation in the kidney tissue. We usually have cystitis as a part of that. You'll have back pain where your kidneys are associated with the inflammation in the area. And if this goes on without treatment, the inflammation can result in permanent kidney damage. All right, moving on to our urinary tract infections stuff. 80% of urinary tract infections are going to be caused by E. coli from your own GI tract. These are going to be the diffusely adherent E. coli that we talked about previously. They've got fimbriae that allow for the attachment to the urinary tract, which allows them to attach better than most GI bacteria would. Catheter-associated urinary tract infections are also usually commonly caused by E. coli, but also can be caused by Streptococcus saprophyticus and Enterococcus species. This is usually opportunistic infections here and moving the bacteria from one part of the body or the environment into an area where they don't normally go. So it's an opportunistic infection, and we usually diagnose it based on cultures and urinalysis. And then best way to prevent this is going to be hygiene practices and limiting catheter usage where possible. When we talk about hygiene practices, this means urinating after sexual contact, as well as if you're going to the bathroom, wiping from front to back instead of back to front. All right, moving on to leptospirosis. This is a zoonotic disease that's associated with animals. Animals can harbor this disease, and it can cause a pretty significant display of signs and symptoms in animals. It's not a super common infection anymore because we do vaccinate for this in domesticated animals for the most part. So this is lepto. There's two different phases of infection. There's the leptospirosis phase where you're just like, you will see the pathogen in the blood and in the CSF, but you'll have like just overall like feeling of unwellness. But if it moves into the immune phase and the immune system starts overreacting to it, the inflammation that's caused from that will lead to potential for leptospiral meningitis, kidney invasion, kidney damage, hepatic disease, jaundice, anemia, and neurological disturbances. So when it progresses to that immune phase, and we have a lot of inflammation going on there, then it has widespread inflammatory aspects to it and can become very severe illness, leading to long-term disability and death in people if they get this. This is a bacterial illness caused by Leptospira interrogans. It's a spirochete, meaning that it's spiral shaped and has a little hook at its end to help it basically hook into the endothelium. It's shed in the urine of infected animals and then usually is transmitted into the mouth or via water as a result of that. And it is treatable with antibiotics. There's a video here that we're going to watch about this in animals.
Leptospirosis is a horrible disease which causes significant kidney issues and significant liver issues. Hi guys, my name is Dan. I'm a veterinarian, and today I'm going to talk about the bacteria Leptospirosis, also called lepto, and what vaccine we use to help prevent it. If a dog does get it, how do we treat it, and what do we see? And most importantly, how is the dog going to do after getting lepto? Leptospirosis is a bacteria. It's a spirochete, and there's actually a handful of different serovars or variations in the lepto disease. So one dog could get lepto, and another dog could get lepto, and there can be different species of lepto. Leptospirosis is usually transmitted by other dogs or from wildlife via urine or their secretion. So I'm sure a lot of you have been to the veterinarian and they pull out this vaccine called leptospirosis, or it's in combination with your distemper parvo vaccine. Like any vaccine, it's not perfect, but the vaccine has been shown to be helpful in preventing the disease. Like any vaccine, you can get vaccine reactions. So that may include vomiting, diarrhea, hives, and in the really bad cases, severe anaphylactic reactions, which would include a very lethargic doggy that needs to be seen by a veterinarian. Leptospirosis is one of those diseases where we don't see it a whole bunch. And I as a veterinarian here in Nebraska, I see it just a few times a year. But the problem with that is leptospirosis is a horrible disease which causes significant kidney issues and significant liver issues. And if gone untreated, and even with treatment, some of them die from it. Some of them develop chronic kidney disease, and it can be incredibly taxing and entolling and life-threatening for the doggy. What does a pet owner notice when the dog has lepto? Lepto usually causes symptoms like lethargy, don't want to eat, or anorexia. They may vomit. The big thing is you may not see the really significant signs until later because lepto will cause liver or kidney damage. And as the disease progresses, the dog you may get like an orange or jaundiced skin. But at first, if it's noticed right away, you may not see the actual problem. You may just see the tip of the iceberg. And under it, blood work wise, we have a major issue. When a client rolls in the veterinary office, we'll do blood work and we'll do urine. And what we're going to see is increased kidney values and increased liver values. Now, a lot of things can cause these values to increase. But if you give me a healthy dog who's like middle age and there's no other pre-existing condition, then magically we're sick, I'm thinking could just be infectious. So based on our history, if we haven't been vaccinated for lepto, we're going to do a lepto test. And sometimes you can do lepto tests in-house. Other times it can be sent out to get it done. And there's different like tests you can do looking for antigens, antibodies, PCRs. But no matter what, we need to diagnose it as lepto. That way we can be confident of what's causing the major organ disease. Once we get it diagnosed, and even without the diagnosis, as we're working on the diagnosis, we're going to get the doggy hydrated with fluids, IV fluids. We're going to hospitalize. We're going to be giving antibiotics, bacteria. We're going to be doing a handful of things, all hands on board, to hopefully help this doggy to feel better. Most dogs with lepto stay in the hospital for a few days. They are zoonotic, so people can get this disease too, and so can dogs. So we need to handle this doggy very carefully with gloves and masks and the whole 9 yards to make sure nobody else gets sick. In some cases, the dogs completely recover and do well. In other cases, we may have chronic long-term kidney issues. And unfortunately, in some cases, some of them do pass away because it is a really, really horrible disease. If you have had any experience with lepto, please go ahead and share and like and provide.
All right, so that is lepto. Moving on to the reproductive tract infections. So we'll start off with vaginitis. This is when you have inflammation of the tissue of the vagina. And this is what is characterized by this. This is why we call it vaginitis, because we'll come to some other illnesses that have inflammation in other parts of the reproductive tract, maybe in the uterus, in the fallopian tubes and stuff like that, but not necessarily characterized by inflammation in the vagina. So when we have just inflammation contained within the vagina area, we call that vaginitis. Signs and symptoms are going to be inflammation of the vaginal tissue, some degree of vaginal itching, burning, and discharge. Causative agents of this are going to be Candida albicans, which is what results in yeast infection, so overgrowth of natural normal biota yeast, and then Trichomonas. Candida albicans is a dimorphic fungus that can switch between budding yeasts and the hyphae form. It is easily detected with a wet prep and a gram stain. Again, this is yeast, so it's not going to be gram positive or gram negative. It's just going to stain from the stain when we're looking for it. It's a normal part of the biota. 50% to 100% of humans will have it in their mouth, GI tract, and or the vagina. So it's pretty normal one to have. This will have thick curd-like colonies on the walls of the vagina. So this creates a sort of cottage cheese-like discharge associated with it. It's usually an opportunistic infection, and we will treat it with azole drugs. Next is Trichomonas vaginalis, the other cause of vaginitis. This is a sexually transmitted infection. And so this is where I will bring up this concept of sexually transmitted infection versus sexually transmitted disease, and the reason why the terminology changed. So we used to call them STDs, but now we call them STIs. This is because many of these infections, you can have them without symptoms. So they're infections, but they're not actually causing disease. If you're not having signs or symptoms, you don't have disease, but you can still have the infection and you can still spread it around. and give it to other people. So this is a sexually transmitted infection. It is a protozoa. It is a flagellated protozoa. These guys are heavily motile. Whenever we do a smear from the vagina, a wet prep from the vagina from someone that has trick, you will very easily see them in the microscope swimming around in the sample. Many cases are asymptomatic, and men almost never have symptoms, whereas women can have this green frothy discharge associated with it. Guaranteed, if you run in ERs, you will see hookers that have this. When I worked at Southwest Integris, the prostitutes that would come into the ER there almost always had this. They're almost always positive for it. You could pretty much bank on it if they're coming in as a prostitute that they had it. So it's extremely common. It's the most common non-viral sexually transmitted infection by far. So this is trichomonas. Metronidazole is what we will treat this with. Be very clear about this. When we say it's the most common non-viral sexually transmitted infection, we're going to show some figures at the end. But the viral guys are significantly more common, and we'll talk about them in a little while. All right, vaginosis. This is when you have infection within the vagina, but not necessarily accompanied by inflammation in the vagina. This is usually due to overgrowth of different bacteria that are not lactobacillus. So lactobacillus maintains our pH and is our major component of our biome. But when other bacteria come in, so this could be Gardnerella vaginalis, Atobium, and I don't even know these guys really that much, but there are different kinds of bacteria that aren't normally part of the biome that can be introduced from the environment or from somebody else's biome or whatever, and then they will overgrow and cause that fluctuation in the bacterial growth in there. And so this is going to lead to infection within the vagina, but if it goes unchecked, can lead to inflammatory disease in what we call pelvic inflammatory disease, which is inflammation within like the fallopian tubes and potentially the uterus and stuff like that. And then when you have inflammation in the fallopian tubes, then a fertilized egg can't move through the fallopian tube, and so it gets caught in the fallopian tube, and that's what we call a tubal pregnancy or ectopic pregnancy. And that can be fatal to the baby as well as the mother if that is left unchecked, and can lead to internal bleeding that can be quite severe if left unchecked. So this is also something that can even lead to permanent scarring within the body as well. Vaginosis is not sexually transmitted. Again, it's more of an opportunistic infection, but it is more common in sexually active women due to the shift in the biome and the biome not being able to recover from that very well, leading to that bacterial overgrowth. Next is prostatitis. This is inflammation of the prostate gland in males. We can have an acute or chronic presentation. Acute is almost always caused by bacteria and normally from the GI tract. But chronic will present whenever we are resistant to certain antibiotics, and then certain biofilms might form within the prostate, which again should normally be a sterile organ. Signs and symptoms associated with this: pain in the groin and lower back, frequent urge to urinate and inability to avoid the bladder, the blood in the urine and painful ejaculation as well, all due to the inflammation associated with the infection. Again, usually much more common in men that are practicing anal sex without protection. All right, moving on to gonorrhea. Gonorrhea in males, a lot of cases are asymptomatic, but if a male has symptoms, we'll have painful urination and some yellow discharge. With females, this is a mucopurulent or bloody vaginal discharge. So normal discharge would present as pussy or bloody and could result in painful urination. Much more common to see signs and symptoms associated in females than in men in gonorrhea. This can lead to inflammation in the pelvic area, leading to pelvic inflammatory disease. That can then cause inflammation within the fallopian tubes, which we call salpingitis. So again, can be associated with causing ectopic pregnancy, scarring of the uterus that can cause permanent infertility. Children that are born to gonococcus carriers, people who carry gonorrhea because they're infected with it, children that are born this way, they might not necessarily have it from being just in the uterus, but they are exposed through the birth canal, and that can cause infection in the eyes that can result in blindness. This is a picture that is showing the inflammatory effect of invasive gonorrhea in women. And here we have a picture of the fallopian tube and the inflammation and scar tissue that's associated here, causing the fertilized egg to get stuck in the fallopian tube. This is a tubal pregnancy. also known as ectopic pregnancy, and that baby can't develop. It can develop there and it can grow to full size in that tube, but it will cause bursting of the tube and potentially bleeding out of internal organs. And it usually is going to cause birth defects because the baby isn't in the place of the body where it's supposed to be, and so can't develop normally as a result of that. So it almost always will result in loss of pregnancy and can potentially cause more serious effects for the mother as well. You never want to have a tubal pregnancy if you can help it. This is an image of a baby that got the gonococcal infection. So Neisseria gonorrhoeae is the bacteria that causes this. And Neisseria gonorrhoeae got into the eyes of this baby. And if this is not treated early enough, then this can cause such bad inflammation of the eyes, it can cause blindness. And Neisseria gonorrhoeae is known as the gonococcus, whereas Neisseria meningitidis was the meningococcus. Question. Yes, yes. So that can help with that. And so usually that is just to protect that baby from any of the bacteria that could have been in the vaginal tract. But it could potentially help with this. And usually most of the time, the mother will be aware of the fact that they have gonorrhea, or this will have been tested prior to giving birth by swabbing in the vaginal canal to check for whatever the biome might be. Because we'll be checking for strep in that time as well, which I think we're going to talk about in a little bit. Anybody else have any other questions? All right, so Neisseria gonorrhoeae is the one that causes gonorrhea, the gonococcus, and Neisseria meningitidis that causes meningitis. That was the meningococcus, just to let you guys know. So this is the one that's going to present as a sexually transmitted infection. It is transmitted through all forms of sexual contact. Having this infection, because the inflammation associated with gonorrhea, will increase your likelihood of getting HIV from an HIV-infected partner. So that inflammation makes you more susceptible to that stuff. There are several different isolates now of Neisseria gonorrhoeae that cause gonorrhea that are now completely and entirely antibiotic resistant, and so cannot be treated. Moving on to chlamydia. So gonorrhea is known as the clap. Chlamydia is known as the drip. Okay. All right. So chlamydia is the most common reportable infectious disease in the United States. The most common reportable one. So the one that the CDC and whatever is tracking, the ones that you would report. So you wouldn't necessarily report trichomonas. It's more common, but it's not reportable. Chlamydia is the most common reportable infectious disease in the United States, not necessarily just the sexually transmitted. So that should put in perspective how common these sexually transmitted infections really are. And again, most people may not even know that they have these. This is one that in chlamydia, this is one where you may not have symptoms in females, but men usually do have symptoms. And this is, again, known as the drip because of the discharge that's associated with this. Males will have discharge and they'll also have painful urination. Females will have inflamed cervix. They'll have discharge if they have symptoms, and potentially inflammatory disease in the pelvis. But again, up to 75% of chlamydia infections will be asymptomatic for females. So most of them won't have any presentations. Most of the men that are going to have a presentation. If this is left untreated, this leads to lymphogranuloma venereum, which is an invasion of the lymphatic system from this sexually transmitted infection. And that will lead to overall inflammatory response in the body, leading to headaches, fever, and muscle aches. This is caused by the bacteria Chlamydia trachomatis. It's gram-negative bacteria. We talked about how it causes trachoma, leading to the inflammation of the eyelids and leading to blindness like that. But when it's in the the genital tract, reproductive tract of men and women, then this can cause potentially pelvic inflammatory disease. We usually can treat this with antibiotics, and co-infection with gonorrhea is actually really common. You can often have both of them. So here's a video about this. There's a short video real quick.
What you see here is a potential complication of untreated chlamydia or gonorrhea. Now, this scar tissue that you're seeing that has formed inside the abdomen are known as abdominal adhesions, and you're going to see some more here. Now, this is usually due to long-term or chronic inflammation, and it's called Fitzhugh-Curtis syndrome. What you see here is a potential complication of untreated chlamydia or gonorrhea. Now, this scar tissue that you're seeing that has formed inside the abdomen are known as abdominal adhesions, and you're going to see some more here. Now, this is usually due to long-term or chronic inflammation, and it's called Fitzhugh-Curtis syndrome.
All right. And another video here.
I've Have you seen this guy?
Not
You know, the one that keeps telling us to,
Stop running on the treadmill.
well, you might want to listen to this.
Although there are numerous positive aspects to sexual contact, there are also some possible consequences, including sexually transmitted infections. This is the first video in a series about sexually transmitted infections and will cover gonorrhea and chlamydia.
This is up all the way.
My name is Dr. Graham Dersna. Welcome to Bite Size Medicine, your go-to channel for short, easy to understand videos about the common medical topics that matter to you. If you're new, make sure to subscribe, get involved in the comments, and check out the description below for links and resources. Let's get started. Sexually transmitted infections, or STIs, sometimes called STDs for sexually transmitted diseases, are very common. According to the CDC in 2018, 1 in every 5 people in the US had an STI. Of the 26 million new infections during that year, almost half of them were in people between the ages of 15 and 24. There are several STIs, and it is possible to have multiple at once, but STIs are preventable, treatable, and in most cases curable. The videos in this series will follow a similar structure by answering the same questions for each infection. This video covers gonorrhea and chlamydia together because it is very common to be infected with both at the same time, and they present in very similar ways. The infection that we call gonorrhea is caused by a bacterium named Neisseria gonorrhea, and the infection we call chlamydia is caused by a bacterium named Chlamydia trachomatis. Both are transmitted by sexual contact and can infect the eyes, mouth and throat, genitals, and rectum. They can also be transmitted to a baby during delivery. The only way to guarantee that you won't be infected is with abstinence, meaning not engaging in sexual activity. But if you choose to be sexually active, then you can do these 3 things to reduce your risk. The first is to have an open and honest conversation with your partners and discuss whether they have an STI and get tested before engaging in the sexual activity. The second is when you are engaging in a sexual activity, use protection, such as male or female condoms or dental dams. Other birth control methods do not protect against STIs because you're still having direct contact without a barrier. The third way is to enter an exclusive relationship with your partner, meaning you only engage in sexual activity with each other, after everyone has been tested and confirmed to not have any STI. If neither you nor your partners have an STI, you can't magically get one. It is always transmitted from one person to another. Common symptoms for both include a cloudy discharge from the urethra, which is the tube that urine comes out of, the vagina or the rectum, and the color may range between white, yellow, and green. Redness and swelling of the urethra, painful urination or bowel movements, and frequent urination. For anyone with vagina, cervix, and uterus, the infections can cause pain during sexual activity, inflammation of the cervix, and bleeding after sexual activity and between periods. There are several complications if these infections are not treated. For anyone with testicles or a prostate, these can become infected, inflamed, and painful. For anyone with a uterus, fallopian tubes, or ovaries, it can spread to them and cause abscesses, which is like a space filled with pus and the bacteria, or lead to pelvic inflammatory disease, which can cause chronic pain and possible infertility. Chlamydia is actually the leading cause of infertility because it can cause scarring of the fallopian tubes. They can even spread throughout one's body. For example, both can spread to the area surrounding the liver, and gonorrhea can spread to the heart and joints. If the infections have not spread, then there are a couple options, but the most common treatment for gonorrhea is a single injection of the medication in your arm, and for chlamydia, a single pill. If they have spread, then the treatment options are different, and you may have to go to the hospital to receive a longer course of treatment. Yes, you can be reinfected an unlimited number of times because our body is not able to kill these infections by itself. They're not like some other diseases or infections where we kill it and our immune system remembers for next time. In fact, chlamydia is the most commonly reported bacterial STI. A final, very important fact to know is that most people with chlamydia or gonorrhea are asymptomatic, which means they don't have any of the symptoms mentioned above. But they can still get the long-term complications and transmit the infection to other people. So get tested, and if needed, treated. Ask your partners to do the same, and then get tested again to confirm that your treatment worked. Before you go, make sure to like, subscribe, and leave a comment. Let me know if you enjoyed the video.
All right, so that's chlamydia and gonorrhea. Again, they often come together. And as he said in the video, chlamydia is the #1 cause of infertility due to the scarring that it causes in the fallopian tubes from the inflammation called salpingitis. All right, so moving on to syphilis. Syphilis is another old world disease that has basically kind of become more of an issue in the newer world. It's been around pretty much as long as sex has been around, as far as we can tell. It is a sexually transmitted infection caused by a bacterial spirochete. In the 30s, they started this study called the Tuskegee study of untreated syphilis in the Negro male. That continued into the 70s. It's about a 40-year-long study where scientists unethically studied the natural progression of the disease without treating the subjects, even though treatment was readily available and effective. And so they were having Black men who had syphilis come and sign forms that they could not read because they were illiterate. And the forms indicated that they would not be receiving any treatment and that they actually wouldn't be receiving the compensation that they were guaranteed either. And so this went on to observe men developing these severe effects of like neurosyphilis that we're going to talk about and dying from that. About 75% of the participants died from syphilis during this whole process. So definitely very disgusting sort of thing. Again, only just ended in the 70s, not that long ago. Moving on to syphilis itself. We have 3 major stages of syphilis: primary, secondary, and then tertiary. There is a latent phase as well. So again, latency just meaning that we don't have signs or symptoms. It's just a period where you have the infection, but no signs or symptoms. So it's just being maintained within the body somehow. But with primary syphilis, we have what is called a chancre. That is how it is pronounced. A chancre, which is a small red hard bump that appears at the site of entry where the pathogen got in. And so this is usually a painless bump, but it is something that you can see on the genitals, the lips, the oral cavity, nipples, fingers, around the anus, wherever the bacteria got in, there will be this chancre. Then secondary syphilis will develop if it continues past them. Nowadays, most of the time people are going to the doctor if they notice that they have this bump on there, and we can usually treat it in time before it progresses to secondary syphilis. But this is still something that's still rampant in society today, and is easily treated with antibiotics. But penicillin is the drug of choice. So penicillin G, the injectable one, is the one that is the drug of choice for treating syphilis. Secondary syphilis is you're going to present with just this overall feeling of unwellness, but the really characteristic aspect of secondary syphilis is the rash. And so it's a brownish red rash that appears all over the body, and it may be raised or it may be flat, but it's this brownish red spotty rash that appears all over the body and associated with other just feelings of unwellness and swollen lymph nodes and stuff. Latent syphilis is whenever it might just stay harbored in the body and not progress to tertiary phase. But if you get to tertiary phase, we're now affecting all the body systems. So we'll have inflammation and damage to the vasculature overall. We will have gummas that develop, which are like basically like tumor-like lesions. I'm gonna have some pictures that we're gonna see in a little bit. But these tumor-like lesions will develop on the liver, skin, bone, and cartilage. And it's pretty common to see these forming on the face, and they're extremely disfiguring. And then we have the progression into neurosyphilis, where the brain and the nervous system will be involved, leading to blindness, dementia, and then non-functional pupils that can't dilate or contract anymore. This can also be spread to babies. And so this can be spread in utero or during birth. And if it does happen to spread in utero during the development, it can lead to issues with development, abnormalities of the fetus, and can lead to stillbirth and miscarriage as well. So here are some images of these sores. So in image A right here, we have the base of the penis. We have that chancre sore. In image B down here, we have that rash. We can see it very clearly on the soles of the feet of this individual here for secondary syphilis. And then in image C, we have one of the gummas that's associated with those tumor-like lesions that form in tertiary syphilis. So this is caused by the bacteria Treponema pallidum. This is another spirochete that its hooked tip allows it to adhere to the endothelium and epithelial cells. It's basically lipoproteins on its surface creates a strong inflammatory response that leads to that systemic inflammation. Your risk of infection of contracting syphilis is 12 to 30% every sexual contact with somebody who has it. So if there's somebody that has syphilis, there's basically a 1 in 3 chance that you're going to be getting it, or 1 in 4 to 1 in 3 chance that you're going to be getting it. Barrier condoms are effective at preventing the transmission. Here are some images of these gummas. So this is congenital syphilis, where this person was exposed during birth but survived it. So we have the deformation of the nose and the presentation of these ulcers on the face, and disfigurement of the face as a result of having that syphilis. And then all these images that we see here on this forehead, as well as on the face and on the skull of this person over here, these are the gummas that develop as a result of syphilis. Video here.
And I like curiosity is a question at the edge of every thought.
So if you're
Syphilis is a sexually transmitted infection caused by the bacterium Treponema pallidum. Dr. Stacy Rizza, an infectious diseases specialist at Mayo Clinic, says syphilis affects men and women and can present in various stages.
Primary syphilis causes an ulcer, and this sometimes isn't noticed because it's painless and can be inside the vagina or on the cervix. After a few weeks, 2 months, they can get secondary syphilis, which is a rash.
It may then progress to latent stage syphilis, and finally, the most serious stage, tertiary. Pregnant women are not immune to syphilis. Congenital syphilis can lead to miscarriage, stillbirth, or infant deaths. That's why all pregnant women should be screened. Syphilis is preventable and treatable. As for prevention, Dr. Rizza recommends barrier protection during sex.
And that's during oral sex, anal sex, vaginal sex, using condoms, dental dams, and any other barrier protection.
For the Mayo Clinic News Network, I'm Vivian Williams.
All right. Moving on to chancroid. This is caused by the bacteria Haemophilus ducreyi. Again, it's a bacteria. It forms a soft chancre. And so this is painful in men, but usually not in women. You're welcome that I don't have pictures of this one, but it is pretty horrific. And I don't understand how women don't notice it, because it's pretty obvious sore that develops. But this causes a soft, not a hard, small lesion, but a larger, softer one that is usually very moist and mucousy. This is common in the tropics and the subtropics. It's very common in sex workers, and it's more common in men who are uncircumcised, again, because they've already got that inflammatory response from their normal biota. This is treatable with antibiotics. Moving on to herpes. We've talked previously about how herpes can cause encephalitis and meningitis, but now we're talking about the genital herpes. And so genital herpes is caused by herpes simplex viruses. This is herpes simplex virus 1 and herpes simplex virus 2. If you have herpes simplex virus 1, you are not immune to herpes simplex virus 2. You can have both at the same time. Your oral herpes that causes cold sores, typically if you have reemergent cold sores due to like stress and things like that, even if you've had 1 or 2, herpes is forever, you have it forever. Cold sores are typically caused by HSV1, but it is herpes simplex virus. It is herpes, right? And you can transmit that oral herpes genitally, and you can transmit that oral herpes to a newborn baby and give it newborn herpes. So if you have newborn babies, maybe don't let people kiss your babies. Okay? At least not for a while, until their immune system is taking over for themselves, because that can lead to the progression of that meningitis or encephalitis that we talked about previously. So that's usually HSV1 is usually the oral one, but you can get it in the genitals. And HSV2 is usually the genital herpes, but you can get it orally as well. So they kind of mix and match, but usually HSV2 is our more common genital herpes. It causes fluid-filled vesicles that are very intensely painful to the touch, and they'll come back recurrently. Valtrex, which is a version of acyclovir, is commonly used to keep that the vesicles at bay. There is a low level of transmission of herpes, even whenever you do not have an outbreak. So there's still a chance of transmitting herpes, even if you're not having an outbreak. So that's something to be aware of. When we talk about neonatal herpes simplex, whether this is HSV1 or 2, more commonly this is associated with 2, which is the genital herpes, but this can lead to infection with herpes virus in the mouth, skin, and eyes, which that by itself is a 30% mortality rate. But if that spreads into the central nervous system, we're looking at 50 to 80% mortality rate. Any evidence of a herpes outbreak in the mother prior to the time of delivery will necessitate a C-section to prevent the spread to the baby. These are both DNA viruses that hide out in the nervous system and basically become latent in there and will reactivate due to stress, UV radiation, injury, menstruation, changes in the hormones, or other microbial infections. Transmission will be through direct exposure to the secretions that contain the virus. Again, that's very, by far, the predominant way for it to be transmitted. But even if somebody isn't showing an active outbreak with an active cold sore, there could still be virus there from a previous one or getting ready to come out. And so spread people who are less immune competent is going to be a huge risk. Again, acyclovir is shown to reduce viral shedding, and so is commonly prescribed to prevent the spread of it and can even keep outbreaks at bay. So these are the viruses that will hang out in your nerves and then hide out basically in more of the central nervous system and reemerge later on. I meant to have a video of it and I forgot to put one. Here are some images of these illnesses just to compare them. When we have syphilis, we have this small, hard chancre, whereas in chancroid, we have the large, soft chancre. And then in herpes, we have these smaller vesicles that will appear on the genital area. Move on to human papillomaviruses. Human papillomavirus is the cause of all warts in humans ever, is HPV. All warts are caused by HPV. And then our genital warts are certain strains of HPV that are usually associated more with sexual contact. Females will have warts that present on the vulva and around the vagina, even inside of the vagina. And you can even have silent infections of the cervix. So we're not having a wart presentation, but the cervix can become infected with the virus silently. That can then be transmitted to males. Due to sexual contact, males will present with warts on the penis and the scrotum. Both sexes can also have warts on the anus and the skin around the groin, in the thighs and pelvis. And we have this thing called condyloma acuminata, which is basically like wart-like growths growing in like a cauliflower formation, kind of growing up on each other. So this is when the HPV, human papillomavirus, causes warts, but it doesn't always cause warts. It's also associated with cervical cancer. The majority of cervical cancers are caused by silent infections with HPV. And most strains of HPV don't necessarily cause genital warts. They can just be completely silent and then lead to cervical cancer. There's a link between oral sexual activity and the increase of throat cancer associated with HPV as well. So this doesn't just cause cervical cancer, but it also can cause cancer in the penis and the anus as well. The causative agent are these DNA viruses in the Papaviridae family. The more common ones associated with cancer are going to be HPV 16 and 18. There's hundreds of different strains, at least 30 that we know of that cause active effects, whether that's warts or cervical cancer. But there's hundreds of them out there that are less understood. Transmission and epidemiology. So this basically, we will say, if you look at the numbers anymore, about 80 to 90% of all sexually active adults will have had HPV at some point, probably closer to 90 to 95%, just not always diagnosed. Most people's immune systems can clear the virus out and you never know that you ever had it. And again, most of the time is asymptomatic. So there's that, but it has been shown that 25 to 46% of women under 25 are infected with HPV. I don't mean the sexually active age women. I mean all women, all females under 25, 25 to 46% of them are infected with HPV actively. This should put into perspective how common this is. So HPV, by far the most common STI. We don't track it. The CDC doesn't track it because it's so common. And you have probably had it if you have been sexually active. Just saying. So this is the importance of the Pap smears to screen for cervical cancer. Pap smears will also screen for HPV and can like basically identify if you have the likelihood for having the cervical cancer versions of it. We do have Gardasil vaccine. We say it's a 9-valent, meaning that it's a vaccine that protects against 9 different strains of HPV, including the ones that cause genital warts and then the different cancers. And it does seem to be pretty effective. We used to only give it to basically say children from age 13 up to 25, but now they are continuing to administer it to people who are older because it might protect against other versions of HPV that you may not have had yet. And now they're also getting it out to men and not just women. HPV cancers of male oral cavity, anus, and penis are common. So this would be protective against men as well as women. But you would still, even if you have the vaccine or not, would still need to get your pap smears to be looking for abnormal growth. I think I've talked about it before, but I had a pap smear that came back abnormal one time, and it had HPV. And so we had to go get a colposcopy where they remove biopsies of the cervix. And if you haven't had that done, it's extremely uncomfortable. It is painful. It feels like literally somebody's pulling your cervix out of your body. Minimal anesthesia for that. I mean, you're awake for it for sure. They just put on like basically like some numbing cream on there and then take big snips out of your cervix to look at the tissue and look at the progression of the abnormal cells. So I would, if I were you, be aware of this and stay up with your pap smears, because I can't imagine the pain people would go through for actual true biopsies, as well as with actual puncture through the cervix with the true biopsies, or even having to deal with cancer and the effects of that. Still today, we have about 4,000 people a year dying of cervical cancer here in the United States. So it is something worth being aware of. Moving on to molluscum contagiosum. So by far the highest incidence of sexually transmitted infections is HPV, then herpes, then Trichomonas vaginalis. Okay. All right. So molluscum contagiosum. This is in the pox virus. It looks like wart-like growths, again, usually associated with immunocompromised people, but it can be sexually transmitted, usually associated again with sex workers and things like that. But this is that cauliflower growth that we were talking about, and this one's near the anus, caused by HPV, and over here on the right is molluscum contagiosum. Next, group B, streptococcus colonization. So having beta hemolytic strep as part of the biome is something that's in about 10 to 40% of women in the United States. And so we usually test at about week 35 to 37 in the vaginal canal to see if somebody has this as part of their biome. And if they do, then we will give ampicillin or penicillin to try to clear that out of the biome so that when the baby is born, it's not exposed to this. And then if the baby was exposed to this is usually Streptococcus agalactiae that's associated with this one, but this can cause life-threatening infections like bloodstream infections, so that's sepsis, meningitis, or pneumonia are also not uncommon as a result of the spread of the Streptococcus bacteria to the baby. And so I had a student last semester who her baby got meningitis as a result of this and lost his hearing became permanently deaf as a result of the meningitis, and then later died from complications of this. So this is still something that's still an issue today. These are some figures basically showing the incidence of these, prevalence and incidence of these. Look at HPV and herpes. So these are incredibly common. We've got 42.5 million Americans that have tested positive for HPV, 18.6 million people with HSV2. It's the numbers are about 1 in 5 people have herpes. To say. All right, moving on. Our questions, just go over these really quick. What is the most common cause of UTIs? E. coli, excellent. What type of organism is Trichomonas vaginalis? This is a protozoa, flagellated protozoa. All right, what pathogen causes syphilis? So we'll start with what type of pathogen first. What type of pathogen causes syphilis? This was a bacteria, and it's called Treponema pallidum. All right, what disease is caused by Haemophilus ducreyi? It's going to be a sexually transmitted disease. This is chancroid. Okay. And then what pathogen is associated with cervical cancer? HPV. You guys know this one, right? All right. So that is it.